Hi, everyone. My name is Daniel Williams, Senior Editor of Industry Insights at MGMA. Welcome to today's session, Designing a Positive Point-of-Care Experience, How a Holistic Design Approach Improves Ambulatory Care. Thanks so much for joining us. We'd also like to thank Midmark for their sponsorship. As a clinical environmental design company with more than 50 years of related experience, Midmark is changing how care is delivered. Midmark has an unmatched understanding of the point of care and offers a full line of equipment and design services that create fully integrated exam rooms that maximize flexibility and efficiency, while at the same time enhance the patient caregiver relationship and experience. To learn more, visit midmark.com. Now, we have a few reminders before we begin. You can claim ACMPE, ACHE, and CEU credit. After the webinar ends, respond to the survey found in the webinar content list. If you're viewing the on-demand version, respond to the polls and view the entire recording. Slides and resources can be found under the session title in your Enrolled Courses tab. We love interactivity, so please submit your questions, your resources, and comments using the chat area. The education for this session will now begin. In today's session, Kurt Forsthoffel, Marketing Director, Medical Division at Midmark Corporation, and Tracy Timmerman, Marketing Manager at Midmark Corporation, will discuss how taking a holistic design approach helps create a positive point-of-care experience, providing a foundation for effective and accessible delivery of care. Kurt and Tracy, I know you've got a lot of great information to share with us today, so I'm going to turn this over to you now.
All right, perfect. Thanks, Daniel. Thanks for the introduction, and thanks so much for having us here today. Kurt and I, we've been looking forward to this conversation, and we will be focusing in on a holistic design approach and really how that impacts the ambulatory care space. So we're going to be looking at everything from the layout of the facility itself, layout and configurations of the exam room, and then different patient workflows throughout the facility, as well as equipment and technology within that space. So a lot of good topics to cover today. Oops, I went one slide too many. Give me a moment. There we go. All right, so we do have some learning objectives just to kind of set the stage of the webinar. So at the end of today's webinar, you'll gain a better understanding of how layout and configuration of the room and the equipment impacts the effectiveness of the clinical space. So again, we'll kind of start by taking that high-level facility design, and then we'll dive a little bit deeper into the exam room design. You'll also learn which patient-centered workflow design models provide a better experience for both patients and providers. So we'll introduce and review various workflows, whether it's self-rooming or continuous care, and some you maybe have heard of before and some may be new. So we'll walk through those. And then finally, you'll start to realize how equipment and technology that is specifically designed for the clinical environment can really complement operational objectives. We know operational objectives are key whenever there's more and more patients and fewer providers, so providers are being asked to do more with less. So we definitely want to make sure that we're gaining efficiencies in our workflows. So again, taking a holistic approach that looks at the facility, the workflow, and the equipment, you will start to see increased efficiencies that support those operational objectives. So before we go any deeper, we're going to just start with a poll question that Daniel's going to guide us through here.
Yeah, everybody. So the first poll question, how much knowledge do you already have regarding facility and exam room design? We're getting a lot of results in here already. So Tracy, looks like a lot of people are sort of middle of the road, medium on that. Does that surprise you? What are your thoughts there?
Yeah, no, that's great. That's kind of what we were expecting, but this is really just to help Kurt and I understand our audience a little bit more and kind of know where we're at. So that's wonderful. Appreciate you all taking a few moments to answer that question. And hopefully by the end of today's webinar, you'll be able to say you've moved from maybe a low to a medium or a medium to a high. So again, appreciate you all taking the time to do that. All right, here we go. There, sorry, slides are throwing me off a bit, but yes, so we'll dive in. So Midmark, one constant, as you all know, is that one constant is always change. There's always changing, especially in the healthcare facilities. So at Midmark, we're always looking years ahead, looking at different technologies, different innovations, and different trends, just to make sure that we're staying on top of those. So like Daniel introduced, Midmark is the only clinical environmental design company that enables a better care experience at the point of care. And this is really done just by harmonizing that space, the technology within the space, the products and the workflows for the patient and the caregiver. So at Midmark, we're really focused on improving that experience between the patient and the caregiver. And we design a clinical ecosystem on which many physicians practice medicine. So this is going to include everything from the exam tables and chairs, your lights, your stools, your seating, cabinetry, and diagnostic devices. And we really bring all of this equipment together in a coordinated workflow with a focus on a lot of critical elements, such as patient and staff safety, good working ergonomics, and really producing good clinical outcomes. So we're committed to providing those new solutions through design, improved workflows, and technologies that help our healthcare customers deliver better care and a safer environment. So with that, I'm going to pass it over to Kurt, and he is going to walk us through some of those patient-centered workflows.
Thank you, Tracy. There are many forces in the healthcare industry that are driving a major change in the industry. There's a shift from fee-for-service to value-based payments. There's decentralization of care, primarily from the large acute centers into more localized residential settings. There's drive towards connectivity and the sharing of the information. There's consumerism or price transparency that's evolving in healthcare now than more before. And then there's an enormous amount of consolidation of both providers as well as payers in the healthcare industry. And just for the fun of it, let's go ahead and throw a pandemic on top of all of that for good measure. So health systems, what we've learned, are looking for ways to standardize their designs and workflows that can help alleviate the pressure from these macro trends. And the idea behind it is that they can get more value. They're going to have to create more value for the patient with fewer resources going forward. This is just the trend of business and healthcare in particular. So they're looking for ways to do this. So what they really need to do is look at ways to rethink the entire patient experience with patient-centered workflow designs. The idea is that we will walk through a few different designs, but the idea behind all of those is to adding value to the patient experience by bringing all those points of care into that exam room at the patient to make them really the center of the hub in this patient experience. So regardless of the workflow design that we speak to, everything about it is putting the patient at the center of it. So today, in our value-based care environment, design is evolving to be a very strategic component of the point of care system, the point of care ecosystem that we like to call it. So we have patient volumes that are rising, but there's still demand for efficient quality care that still remains constant. Therefore, we're really looking for a design that helps optimize workflows. It can help improve processes to provide the best patient care and provider experience possible, because both of those are very critical for a successful engagement. So the attention to design has never been more important to healthcare systems as it is today, particularly with providers looking for more empathetic approaches that bring together workflows and technologies to help support increased efficiency, as well as safety and improved outcomes. So this is starting to sound a little bit more like AAA or quadruple aim, So the importance of this design connects all of that with a quadruple aim for better patient care experience, improved outcomes, lower cost, as well as improved physician or care team well-being. So how might we do this? So when we look at taking a holistic design approach, healthcare systems are looking for many of the hidden ways, hidden costs in non-standardized processes and equipment. They simply, a lot of times right now, they'll tolerate the fact that as these facilities have consolidated various healthcare networks into one, they have different ways of delivering healthcare, different processes, different equipment even that they use to deliver care. And then all this variability going from one site, one room to another, one floor, one node to another, just adds a lot of variability into the care delivery. And that variability just adds up to a lot of wasted time. They're looking for equipment possibly. They might be trying to figure out how to use this type of device or piece of equipment versus another type of equipment, or where it might be located in the facility. It's estimated that by 2029, there's going to be approximately 2.7 billion healthcare visits in the outpatient environment. That's more than twice all the rest of the visits in the continuum of care when you're talking about anybody who might go to urgent care or emergency department and inpatient or some form of ambulatory surgery center or skilled nursing facility. So therefore, it's really important that a holistic design approach is used to enhance the healthcare experiences, improve clinical outcomes, and increase operational efficiencies, thus reducing cost. So to take a holistic approach, there's really three different components that we're going to look at today. We're going to look at the overall facility design and how that might need to change to accommodate a better holistic approach. We'll look at workflow design within the exam room, and then we'll speak briefly about the equipment and technology that can help deliver that holistic design. So to start, let's look at the facility design. So new designs must be developed together or simultaneously to improve patient outcomes, patient sat, and staff engagement while reducing the cost, again, speaking to the triple aim. And it really starts with the facility design. What is it about the overall facility design that needs to change to accommodate that? So one of the first things you'll want to think about in the overall facility design is what type of patient flow are you wanting through that facility, and what kind of workflows you might need to support from a facility design, delivering that patient flow within to get the patient to the exam room itself. So when we look at rethinking the patient flow, and again, this is primarily speaking to outside the exam room, how do I get that patient to the exam room? There are different, actually, exam room designs that might incorporate or impact the overall facility design. So when we start looking at, there's three major designs that I'll speak to here briefly that could impact the overall facility design, and those being a self-rooming model, continuous care model, and a dual access model. In the self-rooming model, as COVID has come to be, there's been a lot of chatter lately about not having a waiting room. This was something that was a concept for the past few years and has been adopted in a number of facilities across the nation as a way for efficiency. But now with COVID, there's becomes more, it's not just about efficiency, but it's also about cross-contamination and minimization of cross-contamination between patients. So self-rooming model can help eliminate the waiting room, which impacts the overall facility design. We don't have to accommodate or design for and allocate space for a waiting room. But also helps eliminate waste in the fact that a staff or clinician or probably a medical assistant doesn't have to spend time rooming patients. They can self-room. And it also helps eliminate bottlenecks across or the potential for cross-contaminations, as I mentioned before, between patients. So there are some win-wins there if we're looking at a self-rooming design. From a dual access design, this really turns the layout of the overall facility inside out, rather than having hallways with exam rooms on both sides. In a lot of the dual access designs, there's two doors, two entry points to the exam room. And the idea behind it is the patient can enter on one side of the room, and the staff and technicians and and other functions associated by the care team are on a different side of the room, and they access through a different care or waypoint. So that second door, as shown in the back of this room. The idea behind this is again, another way to help minimize or conflicts in workflow. You have a separate hallway or access point for the patient. So only people that use that corridor would be patients. On the other side, that's where all the caregivers are working, and that's where resupply would happen. That's where the cleaning crew would come in to refresh the room. That's where waste, potentially biohazard, gets removed from the room as well. So that is all separated from the patient in their engagement, and that allows the patient to, again, have a cleaner flow to their room. It allows the care providers to access the room without having to engage with patients in the corridor, and it just provides for a much cleaner workflow in that layout. And then last but not least, the continuous care model. This concept here is around having a room that is more multifunction. When we say continuous care, it's something that is used not only for the patient exam engagement, but also could be used for consults in that room. So there might be a design space in that room that's designed more for consulting and reviewing data and information, and maybe developing a care plan with the patient. It also could be used for virtual visits. As we know, with COVID here lately, that really opened up and removed a number of barriers from virtual visits by allowing CMS to allow virtual visits by healthcare providers on a more open space. And now let's talk about workflow design. Now this is really what we're talking about within the exam room. Fundamental to any workflow or exam room layout, whether it's a continuous care model or dual access model, or what we have here, what is simply titled dedicated zones, is the layout of the exam room in such a way that we maintain a very patient-centered design, but we go to great extents to separate the two major elements of that exam room. We have what we call the private zone, which is located at the top of this diagram. It will look either blue or gray on your screen. This is where the physician or care provider engages directly with the patient. The equipment is located in a way that minimizes the work zone that the provider needs to use to access either IT information, diagnostic devices, or supply cart possibly. So that keeps it nice and tight and compact for them to minimize movement. At the bottom, the room is designed what we call the public zone. The public zone is designed to allow the family or visitors that come with that patient, the escorts of the patient, to come in that room as well, but locates them in a separate area away from where the work is being done between the provider and the patient. This provides just, again, a very clear and separated workflow, almost like if you were to walk into somebody's office and it's a very clear situation where there's a desk and a chair and there are guest chairs out front. The idea is to make this clearly separated and very natural for people to automatically look and see and realize where their place is in that room. When we talk about this with regard to a continuous care zone, this is one, like I said before, which really all of these are designed around making sure that the patient is at the center of the care. So in every engagement, regardless of whether it's dedicated zone, continuous care, or dual access, the idea behind this is once that patient is roomed in the exam space, they no longer have to go to other areas of the facility. The idea here is that to save time, is that the patient is brought to the exam room and other points of service, whether it might be a blood draw, vitals acquisition, or other services, all happen within that exam space. And the idea behind that is to minimize conveyance of that patient to multiple points throughout that facility, which makes it, again, time savings as well, but now in the world of COVID, it also adds an extra element of minimizing infection cross-contamination. Next slide.
We've got our next poll question here. How much time do you think is saved per patient when bringing all vital signs acquisitions to the point of care, including weight, and using an automated device? You can fill that in there. Kurt, we're getting most of the responses in already. Looks like it's pointing toward more than a minute. Is that surprising? Does that sound about right to you? What are your thoughts there, Kurt?
No, I think that is the correct answer. We had the best answer. We actually had a time study conducted. We went to 12 non-acute care facilities. We time studied 667 patients across 3 different modes of vital signs acquisition, whether that be the traditional kind of hallway setup where somebody would go to a hallway and get their vital signs, or at least their weight captured, and then go to the exam room and get their vital signs manually captured. We also measured it against what we call a triage nook type of exam, or a vital signs area, where they would go from check-in to this vital signs nook area where they would get all of their vital signs captured. And then we also compared it then to taking the scale and the vital signs process all into the exam space. So you didn't have a patient, and particularly in the winter in the northern states in which I live, where someone walks in, they're going to get their weight taken, so they're going to slip their shoes off, they're going to take their coat off. If it's somebody with a handbag or backpack, they're going to set all that down. And then they're going to go and they're going to hop on the scale, and they're going to get their weight captured. And then after their weight's captured, they're going to put their shoes on, put their coat on, pick up their personal effects, and then move on over to the exam space, where quite often they're going to take their coat off, possibly take their shoes off, and repeat the process. So the idea behind this is that if you can bring it all to one point of care location, you minimize all that redundant conveyance, unnecessary conveyance with that patient. So our study found that it saved roughly 69 seconds per patient for the medical assistant or nurse to conduct the rooming and vital signs of that patient. And that's just with vital signs. If there are blood draws, there's additional conveyance there. If there's imaging that can be done with a mobile unit in the exam space, again, that's more conveyance. And it's not just the conveyance that can add up, but what we also found is if somebody, say, had to go from an exam room to a lab within the clinic to get their blood drawn, now there ends up being a queue there as well. So they're waiting possibly in the hallway to get their weight taken. They go in the room, have their visit, go get their blood drawn. Now they have to wait in a queue at the lab to get their blood drawn as well. So that just extends that patient visit in a way that is not exactly something that patients find of value. You know, most patients, when the study was done, which was pre-COVID, didn't want to spend any more time in a doctor's office. I know I'm that way, and now post-COVID, people are already more apprehensive to spend any unnecessary time in a physician's office. Okay, next slide. We're talking about the equipment and technology impact on in the exam space. Any equipment that can be designed to help increase accessibility and safety for the patients and or the caregivers is of high value. The U.S. Access Board, which makes recommendations that can get adopted by the Department of Justice for modifications, say, to the Americans with Disability Act, they define an accessible exam chair that needs to have a seat height of 17 to 19 inches. So in that case, that eliminates the need for somebody to hop up on say a fixed height exam chair or exam table, which for a young person is not an issue, but if somebody has maybe they're elderly and they don't have the balance they did once when they were 25, or maybe they just have some orthopedic issue that makes it difficult for them to get up on steps and try to hike themselves up onto a fixed height exam chair or table. It really does provide, removes the issue of potential patient fall. It also removes the issue of potentially having a healthcare provider provide an assist for that patient to get on, so that reduces the issue of potential injury to the provider as well. It was interesting, the healthcare industry, nursing industry has the highest rate of musculoskeletal injury of any job out there. And even when you compare it to something like construction-related injuries, and that's related to supporting patient transfer on and off equipment and exam tables in the space. From a technology perspective, when technology can be integrated into that exam room environment and you provide that connectivity, you can bring very important information to that point of care. It's not just about capturing vital signs and posting it up to your EMR. It's really about being able to access data from prior visits, compare it to current visit data. That could be vital sign. Blood pressure is the classic one. It's the one vital that seems to be captured with every patient engagement because it can tell so much about the patient's status. It truly is, as our chief medical officer here will say, it's the window into the overall health or soul of the patient, and it's really a critical measurement. But even that, you can also access, let's say possibly if you had an ECG that was captured digitally, you can go back and you can compare that ECG to an ECG you might have just captured here, spirometry tests or for lung functions for, say, a COPD patient. All this data provided properly at the point of care makes the visit that much more valuable and effective by the provider engaging with the patient. Another one here is speaking to automated vital signs devices. This is like I said, a very classic one, capturing the temperature, possibly the weight, the SpO2 levels, and of course blood pressure. There is time savings that can be directly associated with that. You can also, the beautiful things about automated vital signs isn't so much that they provide a more accurate reading, but they will provide a more consistent reading, patient to patient, day in and day out. The human element, it differs. Every medical assistant or that measures the blood pressure, they all have their own particular ways of doing it, and they have slight variations that can cause different readings, subtle enough over time that the recent blood pressure study that has recently changed the standards is recommending automated vital signs, not because the human can't do it, it's because there's variations between provider as they capture those blood pressures. And the beautiful thing is, in most cases, those automated vital signs can be posted directly into the EMR, and that eliminates time to either print, scan, or enter that information into the EMR, and or run the risk of transcription errors, because there are studies that show that manual entry of data has a 17% error rate, and automated vital signs connected to an EMR can handle that. With that, I'm going to turn it over to Tracy, and she's going to talk about the benefits of a holistic design.
All right, thanks, Kurt. There we go. All right, yep, so Kurt just walked us through a lot of the patient workflows. There's many to consider and benefits to each. It just points out that when you do take that holistic approach to the facility design, think about how your patients are flowing throughout the facility from the minute they walk into the door, the waiting room, the hallway, into the exam room, thinking of that entire workflow. And then also considering that equipment and technology, it's going to lead to several benefits. So, and again, as they rethink that design, some of the benefits that we're going to highlight today are that enhanced healthcare experience. So you heard Kurt talk about a patient, having to stop in the hallway to get their weight and waiting at different points throughout their visit. If you reduce that wait time for them, it's going to enhance the patient visit. But you'll also, and if you keep a design where everything is within arm's reach for the physician, where they don't have to search for equipment or different assets, everything's right at their fingertips, that's going to help the physician as well. Even in the image that you see here on the screen, you have that private zone that Kurt mentioned, where the interaction is between the patient and the caregiver. And in this case, the caregiver has that workstation where the computer screen's right there. She doesn't have to turn her back away. They can have that interaction right at that point of care. So great experience for both. We'll also increase the operational efficiencies. Again, we know that everybody's being asked to do more with less. So if we can increase those efficiencies, it's certainly going to add value. And then expanding care everywhere. This was definitely true in the last year through a pandemic. We wanted care available outside of the traditional exam room through telehealth. People wanted to stay home. So I know I utilized that several times throughout the past year, if needed, was to do a telehealth visit, and it was a great experience. So we'll see that, I think, continue on. And then improved clinical outcomes. The more you standardize on your equipment and your processes, you'll start to see those improved clinical outcomes. So we'll dive into a little bit of these each here on the coming slides. So again, workflow design is going to enhance the healthcare experience in a variety of ways. So patient-centered workflow designs, and that patient is brought right to the exam room. So, and you could, even if you do this in self-rooming, they go right to the exam room, reduce waiting time, reducing risk of cross-contamination, and then everything is then brought to that space in the exam room. So once you're in the exam room, weight can be taken discreetly and efficiently right in the exam chair. And if the design of the exam chair supports proper patient positioning, you can get an accurate and repeatable blood pressure every time. So if the patient's back is supported, their feet are flat on the floor, arms at heart height, that's the positioning to get that accurate BP every time. And then with the addition of the connected automated vitals, again, that patient was brought right to the room. They're still in the exam room on the exam chair, and they can get their temperature, you can get your pulse, your oxygen saturation. So all of that was done right at that point of care. The patient didn't have to move around or to different nooks. Everything's done right there. And then once all of that vital sign is collected, that data can then be directly imported right into the EMR, saving time and eliminating manual transcription errors. We know when done manually, those transcription errors can run around 17%. So definitely want to try and avoid those with this automated data. And then the patients, these workflows can also create a safer environment by reducing conveyance. Kurt talked about this a little bit as well, but you think about those patients who are in wheelchairs, or if they have a walker or some kind of support, it can be really challenging for them to get throughout the facility. So the less you have to move them around, the better experience it's going to be for that patient, no doubt. And then also reducing exposure to contagious pathogens, reducing that cross-contamination. Again, just like Kurt said, if you're not, if you have that self-rooming workflow, patients going right through, they don't have to stop for wait in the hallway, safer environment, less cross-contamination between patients. And then all of this can then be done while, of course, maintaining that important patient-provider interaction as technology is seamlessly designed in. So there's a lot of ways where technology can support the environment. It can support, reducing those manual transcription errors, giving data readily available for physicians right at their fingertips. All of that can be done in the background we don't want to impede on that patient-provider experience. We want them to be right at that private zone without any interruption from technology. All right, and we have another poll question. So Dan, you want to walk us through this one?
Yeah, so what do you think is a typical exam room utilization? So we'll see what shows up here. Tracy, be interested to hear your thoughts here. We are getting pretty close, I think.
Yeah. Yep, so it looks like about half think, the majority thinks 54%, and then behind that is 33%, 17%. So the correct answer is actually 33%, which does seem staggeringly low. So I'm not surprised that a lot of people were thinking maybe 54%. So yeah, that's amazing. It's like 2 out of 3 hours that room's not being utilized, and there's a lot of equipment in there, right? There's the technology. You might have workstations or computers or the your exam chairs. You want those to be utilized as much as possible. So definitely a staggering number to realize. So again, a few things to consider is just how can you streamline the patient workflow? And we really talked about this in depth so far, as different workflows can get more patients through the facility, but you also want to free up time for your physicians. So I've never walked into an exam room and had a physician waiting there for me. They're busy. They've got a lot going on. So we want to help our physicians as well. And one of the ways to do that is just to keep everything right at their fingertips. We don't want physicians looking for different equipment or technology. We want that all within arm's reach. And one of the ways to help with that is asset tracking through a technology called RTLS, real-time locating system. So that's one thing that may help physicians out so they don't have to go searching for different equipment throughout the exam space. All right, thanks again for answering those questions for us. All right, so the next benefit we're really going to hone in on here is the increased operational efficiencies. So with a connected ecosystem, again, everything is done in the exam room. And with EMR connectivity, data is readily available to make informed decisions at every step of the patient visit. So we talked about really helping physicians and making sure everything's within arm's reach or right at their fingertips. That includes data. So with connected ecosystem, they have the reports they can pull up and reevaluate with that connected ecosystem. You also gain greater visibility to existing workflows and processes, and those are made available through that RTLS, that real-time locating system that I mentioned earlier with the poll. And this can really expose opportunities for improvement. So what RTLS is going to do is it kind of gives a bird's eye view of where your colleagues are, where patients and equipment is located within your facility. And the screenshot here on the screen gives a visual of what that bird's eye view may look like, which rooms are being utilized, which ones aren't, who may be waiting longer than others, and just where different pieces of technology may be located. And this is done by using badges that are worn by people. Tags can be affixed to different pieces of equipment, and then there's sensors placed in the facility or in the ceiling of the facility. And then with the use of sophisticated software, that RTLS is going to gather location data, and then it turns into actionable insights to improve workflow. So again, just highlighting where the bottlenecks are, really giving you a place to start on where you might want to standardize or build some improvements into your facility. All right, and then the final benefit that we're really going to review today is that expanded care everywhere. So technology has continued to advance, and the shift to create more accessible patient-centered experience is really driving the need to expand the point of care outside of the traditional model. And like I mentioned before, COVID really proved that telehealth was a need as well, and probably accelerated the virtual visits through that pandemic. And it's really proved to be a viable and long-lasting option. And then equipment such as mobile workstations allow for flexibility within the exam space, and they can be utilized for those telehealth visits as well. So that's just one way to add some flexibility within your space. And then finally, that continuous zone I think Kurt mentioned that one earlier, where you have just more a versatile room with those continuous care designs for conducting virtual visits, where you have kind of the consultation zone and the exam public zone. You can use that space in a flexible way to support those virtual visits as well. So those are just, again, a few of the benefits that are brought to light as you introduce some of those different designs and workflows. So with that, I'm going to pass it back over to Kurt, and he is going to walk us through the improved clinical outcomes.
Thank you, Tracy. Yeah, the last section we want to speak to here is around improved clinical outcomes that are possible with a clearly thought out and connected ecosystem. One of the things we want to make sure, and I would imagine a lot of people on the call had some experience with the pain that the industry went through when EMRs were adopted into the healthcare systems. Promises of great time savings, and then there became a lot of time spent on data entry. So one of the things to always keep in mind is we don't want to let the technology be disruptive in the exam space. So what we really want to do is by putting in the proper workflows with the technology, we can help improve the clinical outcomes in a number of ways. We briefly talked about blood pressure measurement, and I'll talk about that a little bit more. I mentioned patient and staff safety. There's infection prevention considerations, and even around instrument processing for those who have instrument processing on site. So on the next slide, we'll talk about blood pressure measurements. I mentioned this earlier. Blood pressure is captured in nearly every patient encounter, and it's a very important factor, a very telling factor in the point of care diagnosis of understanding the patient risk stratification, medication dosing, and even slight variations in technique and measurement can have a really big impact on the efficiency, accuracy, and the outcomes. The American Heart Association recommends that during any BP capture, there should be no talking with the patient. The patient should be seated comfortably. Their back should be supported. Their arms should be supported at heart height. That's shown in this image here. The cuff will be on at heart height on a bare arm. The legs should be uncrossed, and the feet should be flat and supported on the floor. And what studies have shown, unfortunately, is that even though this is trained very early on in all medical programs, the studies show that about somewhere between 2 out of 3 and 3 out of 4 times these guidelines are completely followed. It can lead to 16% increase of Americans at risk for errors in blood pressure measurements of greater than 5%, either up or down, which means what we could have is a misdiagnosis or a misdiagnosis, which can increase the risk of stroke or heart attack, or for that matter, adverse drug reactions. So 30 million Americans could be affected by overestimating their blood pressure measurement by just 5 millimeters of mercury, leading to an inappropriate treatment program and possibly even unnecessary cost. It's estimated that the annual cost to the U.S. healthcare system is about $46 billion because of either people that are underdiagnosed and have issues, complications, or those that are overdiagnosed or overprescribed and taking too much medication. That could also, it's wasting unnecessary medication, but it's also could lead to issues with that patient and their medications. Next, we'll briefly talk about patient and staff safety. I mentioned this before, and this diagram highlights what the American with Disabilities Act would recommend for an exam room layout. Then there's two diagrams here. The light blue or gray coloring again here, those are what we would call the federal guidelines requirements for spatial considerations on an exam room design or layout, whether that's a certain width of the door, certain space between the wall and the door handle for a patient to access, a wheelchair user to access a door handle, a turning radius that allows them to get their chair in the room and properly turn and navigate the space in the room, side on one or both sides of the table chair to allow the patient access to that chair. The teal boxes can be, some state regulations are actually more restrictive or a higher level of requirements than the federal regulations. So in some states, the blue line outlines an expanded requirement. So the federal guideline, for instance, requires, I believe, a 60-inch turning radius for the wheelchair, where some other states require something as large as 72 inches. Some manufacturers or guidelines, federal guidelines, I believe, require a 32-inch door, where some states require a 36-inch door. Or access, that side access in the bottom right of the diagram. Some federal requires 18, some states require 24. So understanding exactly what the room size requirements are, the types of procedures that need to be done in that space, the type of equipment that's used in the room, the state in which the room is being built, to make sure that, yes, you may be federally compliant, but you need to make sure that you're compliant with the state requirements as well. What kind of mobility devices do you anticipate being used in that room by your patients? Wheelchairs, walkers, other type of devices, scooters. And then this also helps increase the patient throughput in the room if it's properly designed, because no longer do you have to possibly bring in a lift team, which is not something that's highly desirable, which takes time as well to get that lift team pulled together and in the room for that. And it also makes, for that matter, the provider experience much more positive, because they no longer have to provide those services, because this room is set up quite nicely for the patient to very easily access any of the seating or the exam chair, for them to, if even in a wheelchair, possibly do a self-transfer. And these exam chairs can be designed to a low seat height that allows them actually to transfer down in height from their the wheelchair down to the height of the exam chair. And it also takes away the need to locating possibly a lift equipment, if that's the protocol that you might have in the facility. So it just saves a lot of time and hassle factor for the providers as well as the patient, because anything the patient can do on their own is going to most likely be better received by them than requiring a lift team or a lift device to help them with mobility needs in the exam space. And then next, we'll talk briefly about infection prevention. Coming out of COVID, we have all been sensitized to the need for infection prevention, especially in the exam space. Self-rooming workflows that we spoke to before, such as dual access, shown here, is something that that helps patients proceed directly to their exam room that's been assigned to them. It helps them avoid possibly contact with other patients, or other providers that might not be engaged with their visit. You can have technology such as RTLS engaged. Not only can you use RTLS, real-time locating systems, to track assets so you know where infusion pumps, blood pressure devices, et cetera, might be located in the facility. It also can be used as a way to track what patients were in a facility on a particular day. So if you do have some infectious disease outbreak, you can quickly do an automated contact tracing report that will help you identify what patients might have been exposed in that situation. So this is something that is very, very helpful in the COVID environment. We've had a number of customers who have benefited by being very quickly able to identify those customers who may have been impacted and making sure they can contain that situation as best as possible. And then, as I mentioned before, in the dual access workflow, and the fact that you're separating out the provider team, whether that's not just the providers of healthcare, but also the technicians and the cleaning staff and the resupply staff flows from the patient flows. Just again, it adds an added benefit of minimizing the potential for infections, cross-contamination. And then finally, the idea of instrument processing in an exam or in a facility. Instrument processing is very much a critical part of any infection prevention protocol. Most people think about, when they hear infection prevention, they almost a lot of times go to this particular use case. And in most cases, it really needs a designated area for instrument processing if it's going to be done on site. And there is a chance the workflow design may not be organized as efficiently as you may want, or in a way that is supportive of the CDC recommended guidelines. As I mentioned, the instrument processing space should be really located in a separate and distinct area, not necessarily in a room that is used for things such as break rooms and cleaning supplies and such, but an area that is designed specifically for instrument processing and sterilization. It allows for easier control and management of the process, and helps ensure that it's a safe and an efficient workflow as well. It should not share at all the space at all with any kind of laboratory, which is a common occurrence, or staff break room, or be located in any way in a facility storage room. There are CDC guidelines for control and prevention that recommends the inclusion of 5 key steps, as we show here in this chart. The first one is receiving, cleaning, and decontamination. This is where you're going to take a device in. You're going to, in this case, put it in an ultrasonic cleaner, possibly, and then once cleaned, you would take it to step 2, where you would prepare and package it for a sterilization process, which occurs in step 3, where you are actually sterilizing the handpiece or device in the sterilizer. The 4th step is around monitoring sterility performance or sterility assurance, and there are measurement devices that you can measure the effectiveness of your sterilizer function. Is it performing as it should? And there are ways you can, in this situation, they have what is called a data logger. So instead of writing manual logs, which can sometimes get skipped in the hectic pace of healthcare delivery, they can also record this information digitally and export the file rather than trying to print out thermal paper tape. You can just capture the data digitally and export it out to a file for future reference. Because it does happen, locations who do this type of work do get audited frequently, and I believe at least a third of the time, most of these facilities fail the passage. And then Obviously, step 5 here is proper instrumentation storage, which is again separate and protected from the normal work environment. With that, I'm going to hand it over to Tracy.
All right, thanks, Kurt. All right, so just wrapping it up here. So covered a lot of things, talked about facility layouts and patient-centered workflows and different equipment and technology design, and it can be a little bit overwhelming when you think of all of that. So it's kind of like, well, where do I start? So the first thing is seek the expertise from architects and your equipment providers, and then they can help you conduct an audit of your equipment and your workflows. We've seen this done very successfully with RTLS to help set a baseline. That technology can take what your current situation, monitor it for a period of time, and then you'll start to see your bottlenecks and help you make decisions on where to start. And then once you know that, you can start to determine, which equipment, configuration, and workflows do we want to keep, what do we want to revise, and what do we want to replace based off of those bottlenecks or inefficiencies that may have been brought to light with that RTLS technology. And then once you're equipped with that good data, that good information of that baseline, you can determine how you want to standardize. What equipment do we want to standardize to help us take your vitals or your BP the same way every time to ensure good clinical outcomes? What workflows do we want to standardize on to help get our patients through efficiently and with a good experience? And how do we want to standardize our exam room to make sure that all of the equipment and everything is within the reach of the physician once they're in that point of the care with the patient. So a few tips to get started. We know it can be overwhelming, but just starting with that brief audit can certainly help. So with that, I just want to thank you all again for having us today, for participating in the polls. And just really enjoyed the discussion. So thanks again.
Thank you both, Tracy and Kurt. This has been great. We do have time for a couple of questions here. So Tracy, let me start with you. What elements of the exam room can help facilitate better engagement with the patient?
I'm sorry, can you just say that one more time, Daniel?
Yeah, so we had Mark Troxler write in. He said, what elements of the exam room can help facilitate better engagement with the patient? He was concerned that in some instances, you might have the provider with their back facing the patient. Mm-hmm. So you really want to avoid that. How do you do that in that space there?
Yeah, and that's what I was wondering if what was going through Mark's mind was how do you keep that interaction?
Right.
Some of the designs we've heard from customers is they're really concerned they don't want their back, the physician's back to the patient. So one of the ways to address that concern is by treatment carts. You can have treatment carts or workstations that are mobile and flexible, and it again can be pulled right over to the point of care. So if the physician's sitting at their stool, patient's on the exam chair, you can have that workstation or that cart right within that point of care so that they don't have to turn around again when you don't want that technology to interrupt that experience between the patient and the caregiver. Definitely something to be mindful of.
Okay. Kurt, we have a technology question. So Denise is asking and commenting here saying, I've seen the auto locate system installed, but it didn't work. Is the technology to that getting better? Any thoughts on that, Kurt?
Well, there are a couple different technology applications that can be used. And depending on the level of granularity that you would want in your facility, some are better suited than others. For asset tracking, you may not need to have a high level of granularity around the exact within a foot of where that piece of equipment is located. Maybe you need something that is just get me accuracy within 10 feet, and that's close enough. When you're talking about possibly the movement of a patient or the location of a provider, if they're needed quickly, or in some cases, the systems also serve as a nurse call, staff assist type of a function as well. A higher level of granularity can be designed into the systems to make sure that you can get that precise location of what is needed. So there's a little bit of a trade-off between, in this case, there really is a direct correlation between possibly the installed cost and delivered value from an accuracy perspective.
Okay, thanks for that, Kurt. Tracy, I have another question for you. Have you seen an impact on supply management when introducing a new workflow?
Yeah, no, it's a good question. We do oftentimes, we hear the concern of supply management and just how to best address it. So some of the workflows can certainly help alleviate some of those challenges. The one that comes to mind is the dual access that Kurt covered, where you have the on-stage, off-stage setting, where on-stage is what the patient experience is. We want to keep that neat and tidy. And then the backstage can be where the care team is, and that's where you can have the resupply, or trash can be taken out, or just that can kind of be your corridor to keep that separated from the exam space.
Okay. I think we have time. We've gone over a minute, but I think we've got time for one more question, Kurt. Have you seen Selfroom typically implemented?
How have I seen it implemented?
Yeah, how have you seen Selfroom typically implemented?
And again, I've seen it implemented in a very simplistic fashion, in that the facility was designed where someone was given, I call it the gas station badge. It's an oversized, kind of hard to lose, misplaced type of deal with their room number on it, but also they would have the corridors categorized. In one facility I was at in the Pacific Northwest, they had a rainforest room, and they had the ocean or rainforest corridor and the ocean corridor, and it would allow patients to find their room quickly. I'm on a webinar. They would allow the patients to find their corridor very quickly, and then their room quite nicely. So there was a very low-tech approach to it. In other situations, they're using an RTLS system to help engage as well, because it would allow the patient, again, to find their room and allow the care providers to track their location as well. So they would know exactly when a patient got into their room without having to manually notify it. Somebody going and notifying the care providers to know that the patient is in the room.
Okay.
So two extremes. It doesn't always have to be the high cost. It can be very simplistic. I say the large oversized gas station badge.
Okay. We did have one more question come in late here from Thomas, so we'll end with this one. Stick with you, Kurt. Have you seen a trend of sliding barn-style doors versus swinging doors for exam rooms? What are your thoughts there? What have you seen?
Yes, we have. They are more expensive usually to install, but the benefit of them are obvious, that you do not have door swing, and that door swing takes up space. So if you're designing, say, for an ADA type room, that eliminates the need for you to allocate space for that door swing. So this is a real great advantages, and it's quite easy to make a very wide opening then for that exam room. So there is a trend there, and it's I think it's very interesting in the fact that it is a space-saving design.
All right. Well, thanks for that last bit of information. Kurt, Tracy, this has been a great presentation. Very interesting information here. So thank you for sharing it with us. And thank all of you for joining us and for providing your engagement as well. And these questions have been good and kept Tracy and Kurt thinking here. The education for this session is now ended. Once again, we'd also like to thank Midmark for their sponsorship. As a clinical environment design company with more than 50 years of related experience, Midmark is changing how care is delivered. Midmark has an unmatched understanding of the point of care and offers a full line of equipment and design services that create fully integrated exam rooms that maximize flexibility and efficiency, while at the same time enhance the patient-caregiver relationship and experience. Learn more by visiting midmark.com. Now, if you do have additional content questions, contact Tracy Timmerman at ttimmerman@midmark.com. And if you do have a webinar question, contact ed@mgma.com. And if you haven't already, please click on the evaluation link. It's located in the chat area. As a reminder, we're offering ACMPE, ACHE, and CEU credit for this webinar. For information on all of our conferences and webinars, please see our events page. Thanks so much. We hope to see you at a future event.
Yeah. Thank you, Daniel.
Thank you.